Hi, everyone. Welcome back to another live session with Apne Santé. Today we have a special guest. Let me introduce Louise Malone. How are you, Louise?
I'm well. How are you? Can you hear me all right?
Yes, I can hear you very
Good
clearly.
stuff. Good.
So Louise Malone is with us today. Louise studied in physiology and kinesiology at McGill. She's also a certified sports therapist and works at the YMCA as a trainer educator. So again, thank you for joining us today, Louise.
Nice to be here. Thanks, Riz.
Thank you. So today our topic is exercise and overall health. So we all know that exercise is good for us, but it's a common knowledge that exercise, we do it for our aesthetics, to lose weight, to get our calories out. But I think it's beyond that, and people tend to forget that it has benefits for our overall health, such as reducing cholesterol levels, might even reduce our intakes of medication. It has benefits for our mood, our mental health. So today, like I said, for those who are joining us, our topic is about exercise and overall health. So Apne Sante wants to launch a campaign that is called Movement is Medicine. So as we are getting out of lockdown, what we want to get everyone to do is to be more active, because this just has benefits, and this is what we're going to get into the detail with Louise today. So we want to talk about another epidemic that's been exacerbated with COVID-19, and which is sedentarism, and how people are more inclined to being at home, sitting down, and that brings in a lot of health problems. Just to name a few, the comorbidities with sleep apnea, such as high blood pressure, cardiovascular diseases, diabetes, type 2 diabetes, stroke. So that's what we want to talk about today. And I think that's a very interesting topic, because it does not only touch our patients, but I think this is for everyone from all ages. Students are now forced to be at home, homeschooled, work from home. So Louise, can you explain a little bit the decline in being physically active in today's society?
I think it's a multitude of factors. To date, 80% of Canadians don't do sufficient amounts of physical activity to hit that threshold where you start to get benefits from exercise. If we look at how we spend more hours than ever in front of a screen, the decline of physical education in the school system, people are working more, spending less time with family or for themselves, and just the overall pace of life, the stress can be a tremendous zapper of energy. So oftentimes people will say, I'm too tired, I don't have the oomph to exercise. So there's a lot of factors that feed into why we're not doing enough.
That's really surprising. 80% seems to be a large number. And is this just a specific age, or 80% of the entire population?
It's pretty much across the board, and we're seeing a disturbing upward trend among younger people. The current cohorts of children and youth are probably the most sedentary we've ever seen in history. So that's not a good sign.
Oh yeah, that's and I think that also can explain. Well, here, let's go to question number two, because this new lifestyle of being sedentary, does it have a direct impact on our overall health? With COVID-19, we've all become homebodies, right? So how does that impact our health?
Well, sitting is now being referred to as the new smoking. Sedentary living is now considered a primary risk factor in cardiovascular disease, and we can link it to a number of chronic illnesses. On top of all of this, the sedentary lifestyle is that our population is getting older. We have a higher number of aging adults, of older, frail adults. Frailty is also associated with a high incidence of comorbidities.
Mm-hmm.
So it's kind of a perfect storm of lifestyle, that like a general lifestyle change with an aging, less healthy population.
I think that's really interesting. Question number one and question number two, that you're saying it's 80% all across the board of ages. And I think that's why I'm seeing more and more younger patients coming to see me for sleep apnea. So I think, that's linked to the new lifestyle that we've adapted. That's really interesting. So because we're talking about age, often I see a lot of my patients saying, "Yeah, well, I'm too old to go work out." So is there an age, whether young or old, to even get started being physically active?
There are centenarians, people over the age of 100 who are still competing in athletic endeavors. So you're never too old, and there's never an age where you can use age as an excuse. You can start exercising at any point in your life and reap benefits.
And this is young and old, right?
Oh yeah, young, and of course young, absolutely. I mean, kids that do regular physical activity will end up with greater bone density. Um, there's so much research to back up why it's important to exercise in all phases of life, but in particular through childhood and youth and adolescence.
So now some of our patients suffer from obesity and overweight. I think this is a lot of our patients, because that also brings in sleep apnea. So a lot of my patients, and this is even common, I see this on social media, my friends, they say, before I get started, before going to the gym or before getting into a physical activity, I want to lose weight first. So how would you approach this?
Well, it's kind of like cleaning up your house before the cleaning lady gets there. There's not much logic to it.
Mhm.
And when we're talking about carrying extra weight and obesity, there's a lot of pieces to the puzzle. Physical activity, nutrition, managing your sleep, managing your stress, they all have to be addressed, and you can't necessarily, kind of do one without the other. So there's no excuse not to start with physical activity. There's a lot of benefits, in fact. Um, just, to clarify, exercise alone is not the best vehicle for weight loss. There's all the other moving pieces have to be there. But what exercise does, it helps to manage stress. And there's a growing body of research that exercise can help with the modulation of the hormones linked to appetite and hunger, so leptin and ghrelin. And exercise also confers a lot of other hormonal benefits that in the long run will support weight loss strategies.
I like that. So in order to get started, exercise helps kind of close the loop into all of the
Yeah.
weight loss. I like
Yes.
that.
Yeah.
So now talking about exercise. So what constitutes an exercise? Even for myself, sometimes I ask myself, how long should I be running for, or am I doing enough? When we're talking about exercise, how much time should we dedicate in exercise, and what kind of intensity, what kind of exercise?
Yeah. Very good question. And it's probably the most commonly asked question, and it's probably the one that most people wouldn't be able to give you a straight answer. So we'll start with what's considered the minimal threshold. In order to reap benefits related to health, the threshold is 3 times per week, a minimum of 30 minutes per training session. And that's when we're talking about cardiovascular activity. And it's this threshold that after even just a couple of weeks, we start to see changes in resting blood pressure. We see a decrease in the resting heart rate. We see improvements in insulin sensitivity. So you're going to get benefits almost out of the gate, so to speak. But that 3 times per week, 30 minutes is a really good foundation. Now, you asked how hard should I work? Typically, with anyone starting out, they should be looking at about, let's say, a 5 on 10 in terms of intensity, meaning it should be tolerable and it should be sustainable. Now, there's some people who will not be able to sustain 30 minutes, so break it up. 10 minutes in the morning, 10 minutes at lunch, 10 minutes after work. So that's going to be your initial goal. And from there, depending on how you're doing, what your goals are, you can then layer it. You can add other activities. You can bump up the intensity from that starting point.
I think that's really interesting because I'm guilty of that a lot. When I say I'm going to dedicate an hour and then I'm lacking time, I forget that I can break down that hour.
Yeah.
And I think for some people that becomes a barrier that we don't have that time. So how I guess you've answered my question that would be one of the barriers, the time. But there are also other barriers, especially now with the closures of gym. How what would you recommend, or how can we incorporate these basic activities in our daily lives?
Excellent point. First and foremost, anytime somebody says, well, I don't have time, typically a question I'll ask is, well, how much screen time are you engaged in throughout the day? But then use it as a motivation and explain to them there's a lot of stuff online. YouTube, there's more and more good stuff on YouTube. There's online programs that you can, your local YMCA. And as I mentioned earlier, at the end of this live event, I will share with anyone who's interested a chart of homework exercises, stuff that you can do at home that you don't need a gym or necessarily equipment for. So we'll have that available to your patients by the end of the day.
Thank you.
No worries. So it's just about looking at what's around you and what's feasible. The outdoors. You have your home. And there's so much out there now in terms of equipment that you can order online. Like for me, COVID, I became an Amazon junkie. I started ordering all kinds of stuff.
I think we'll have.
Elastic you can tie to your door and this and that. So there's a lot of opportunities there as well. For anyone who's concerned about, well, I don't know if this is going to be dangerous for me, are these online links okay? You can speak with a personal trainer, or you can speak with a physical therapist, and typically they'll have resources and references and networks for you to look into.
Now, you mentioned YouTube and social media, Facebook, Instagram, but I think sometimes it can become very overwhelming.
Yes.
Whether you're somebody who's been physically active all your life or somebody who's starting off. So how can somebody pick the right program for them, or pick the right video to follow, for example?
Yeah. I think when you're doing searches, there are certain keywords. For example, beginner, débutant, restorative. So keywords, aging adult, bone density workout, that kind of thing will probably narrow the focus and direct you towards more appropriate online clips.
That's very interesting. I never even thought to use keywords to look for appropriate exercises. Now, so you mentioned that it's easy now to incorporate exercise on our daily lives, being outdoors. But for some patients, a 30-minute walk could be a little bit more of a challenge. So how can they approach and get to that 30-minute walk?
You break it up into manageable chunks. Whether it's 5 or 10 minutes here, there, and do what's tolerable. If something is, and when I say tolerable, it has to be psychologically tolerable as well as physically and psychologically tolerable. So break it into chunks. One other piece of advice I'll typically give clients is, we tend to focus, okay, 3 times a week. Oftentimes, life happens and you get derailed. So rather than worrying about missing, I only did it twice this week, take a step back and look at your month. There's 31 days there. So if you target 10 to 12 workouts within a month, that's also a very psychologically manageable framework for you to, stay encouraged with your training.
I like that because it's true. People feel guilty when they skip a day,
Yeah,
but just stepping out and look at how you've done in a month,
yeah,
that's a different way to look at it. That's a really nice advice.
yeah.
So, mild cardio, so that's easy. But now, how can somebody incorporate strength training, especially for somebody who's never done, or what is even strength training for some people who's never done it before?
Yeah. So the benefits of strength training are unbelievable. Strength training has an insulin-like effect on blood sugar levels. And most people who start strength training, most people who are pre-diabetic or living with diabetes, will notice within the first couple of months a significant decrease in their need for medication, and that includes insulin. So if you're a type 2 diabetic, that should be your focus, your priority. Anyone living with osteopenia, osteoporosis will also benefit tremendously from strength training. So you asked a very good question. Well, what is strength training? Do I need to join a gym? Strength training is essentially anything that tires out your muscles within a given time frame, let's say up to and including 15 consecutive repetitions. And that includes body weight exercises, using household items. I teach an older adults class online, and for the first 3 months, I had no equipment at home. So I had a broomstick with 2 detergent bottles on the ends. I got creative
Improvise.
with, yeah, exact paper plates, all kinds of stuff. So there are ways of incorporating significant and good strength training without necessarily joining a gym, and you can do them at home. As I mentioned earlier, that chart that we'll be sharing it'll be all at home stuff, all at home strength stuff.
Thank you. I think I'm gonna be using that also.
Oh,
so
okay.
so we've discussed about cardio and strength training. So is there one that we should be prioritizing over the other? How can we benefit from both?
Well, in an ideal world, everyone would be incorporating both.
Okay.
So it depends, it does depend on the individual. It depends on what they can handle initially. And my advice would be to get started with what's doable for you, and as quickly as you can, start incorporating what's missing. So let's say you're a recently diagnosed type 2 diabetic. I would get on board and say, okay, I'm going to start doing my strength training. And once you get in a groove, so to speak, then say, okay, how can I add 2 or 3 walks a week to this? So you do it piecemeal and you incorporate, and don't try and make too many changes with exercise all at once, because it's the psychological aspects are as powerful as the physical.
Physical.
The body can handle it. It's typically the brain that can't wrap its head around, what, I have to exercise 3 to 5 times a week. So
Who has time for that?
yeah.
So you said starting slowly. Is there how fast does one get used to being physically active? I think that's one thing that people are like, it's been a month and I'm still struggling. So how is there a time frame? How fast does someone adapt to physical activity?
It's an excellent question. Your current level of physical fitness and your current health status will play a large role in how quickly you adapt. Um, somebody who's been sedentary, somebody who's living with a lot of comorbidities, who's taking more than 3 medications, will probably have a longer rollout. So it's important to stay the course and to just tell yourself it is going to get better. I'm going to struggle less as I go along. Um, I think it's
Eventually
important
they'll
also,
get there.
yeah, yeah, and find guidance in someone, ideally a fitness professional, but also ideally somebody who has a background in working with medically referred clients.
Okay, that's really interesting for our patients because I do see a lot of patients who come not only for sleep apnea, but they've been referred. Some of them don't even have the symptoms. Some of them is just because suddenly they're hypertensive and diabetic. So doctors just want to rule out sleep apnea. So that's very interesting. So we've talked about how it has a direct impact on, diabetes, hypertension, cardiovascular disease. Does being physically active also have an impact on our mental health? Because I think we're seeing more and more of that, not only in our adult population, but even in the younger population, a lot of mental health problems. Is there a direct link?
There's no question. Studies show that regular exercise has the same effects as medication on moderate levels of depression. Regular exercise is one of the most powerful ways to modulate or to offset the effects of cortisol, the stress hormone.
Mm-hmm.
And exercise also stimulates the production of endorphins, of serotonin. It stimulates the production of something called BDNF, brain-derived neurotrophic factor, which creates new links and the growth of new cells in the brain, which can also contribute to the sense of well-being. So one of the things that I've seen in my experience working with clients is that living with chronic illness, depression occurs a lot. It's part of the package, unfortunately, and often is as big as an issue as the medical condition. So exercise is a powerful antidote to that, and it helps people manage that part of their health.
So you mentioned that, for example, if you have diabetes, strength training would be something more beneficial. Cardiovascular would be somebody. Cardio would be somebody for any heart disease or hypertension. Is there a type of exercise you would recommend for somebody suffering from a mental disease, health problem?
There's a lot of really good resources online on YouTube. There's some great mindful meditation clips. You can put in your buds in your phone. I would definitely encourage someone to start with that, even if they're doing other stuff. If they're living with any level of stress and they're having difficulty coping, there's resources there, and they're authentic. They're the real deal kind of thing. So that would be one step. Looking at activities that have, like, restorative yoga. Feldenkrais is something else that's another activity that I find has a nice kind of calming effect. Meditation, just walking outside in a woods or a forest. All of those would help. And it's important to note that if somebody is in a very high state of stress, it may not be the ideal time to then layer on a lot of high intensity exercise. Sometimes taking a step back and starting with something more on the restorative meditation side would be.
So not adding an extra stress, a physical
That's
stress.
right. Yeah, because exercise is a stress. It's a positive stress. But if you're already at the point where your cortisol levels are through the roof and you're not sleeping, you might have to prioritize other things.
That's very interesting. And repeatedly, you've mentioned how your resting heart rate will improve with just starting to being physically active. Your resting heart rate will reduce, your blood pressure, even some medication. So my question is, for somebody who is already affected by any of these diseases, will starting a more active lifestyle reverse this? Or if somebody does not have this yet and wants to get active, does it prevent these diseases?
It can certainly improve what's called the trajectory. So whether you're already living with the effects or you're at risk, you're vulnerable to, exercise really helps to create a better prognosis. I know several people personally who've actually reversed their type 2 diabetes to the point where they're on no medication.
Wow.
Now, I mean, it takes time and effort and work, lots of lifestyle changes, but it's feasible, it's doable. I've seen a multitude of clients get off their blood pressure medications, get off their antidepressants. Obviously, those are decisions you make with your healthcare provider, with your pharmacist. That's their scope of expertise, but it's definitely doable. And again, just as a fitness person. One of the biggest complaints I hear about people living with chronic issues is the side effects of medication.
Right.
They'll often say that it's the medications that are messing with their sense of well-being. So if there's a way to manage that, why
Of
not?
course. And why depend on medication when you can take this upon yourself?
Very good point. Excellent point.
Yes, yes. So you mentioned to seek professionals, right? Whether you're pharmacists, your doctors, but I guess there are also specialists when it comes to health. And I think there's just so many options out there. So how would you recommend to somebody who's selecting a personal trainer? Is there a process to pick the right one, especially when you have these limitations of diseases?
Absolutely. One of the best ways is to contact, if you already have a physiotherapist or an athletic therapist, they're often tapped into a really good network of trainers. There's several clinics, just in the Montreal area that have trainers that work under the supervision of the physical therapist. So that would probably be a really good place to start. And for anybody who's viewing, I can provide links or with suggestions for clinics like that would be a really good place to start. Yeah.
You seem very knowledgeable, and I know that you're a fitness trainer. Are you taking in some patients or some new clients? If not, would you be able to guide us?
I'm not at the moment, but I am also tapped into a network of very, very well qualified trainers who have a lot of experience with this. So if anybody wants to be in touch with one of those people, I would be happy to, I'll put my contact information and I can put them in touch with trainers that I've worked with and seen in action who are outstanding.
Thank you very much, Louise. That was a very, very interesting topic. And what's nice about this topic is that it does not only touch our patient population, but like we said, sedentarism has become very common.
Yeah.
80%. And I think that's a huge number. And not only does it have an impact on your personal life, but also everyone around you, just our medical field, our more and more people are having to seek medical professionals. So thank you very much for answering our questions, Louise. That was very interesting. So just to sum it up for those who joined us a little bit later, Louise was our guest today. She's a personal trainer, and she discussed how being physically active has direct impact on our health, and sometimes it can even be reversible for some of the diseases that we've had, and even preventative. And I think preventative here, Louise, is the key, right? Start as soon as you can to prevent these illnesses, and even maybe reduce medication intake.
Sure.
And I like that. And I think one of the advice I'm going to take from you, Louise, is break down your workout. You don't have to dedicate an hour, but break down that hour in the day. And I love that, because it's true, I don't always have an hour to dedicate.
Well, if I see you running around the parking lot, I'll know what to.
That's gonna be me. So thank you very much for
Thank
joining
you.
us. And so again, the world around you is your gym. So you don't have to commit yourself to a gym or expensive equipment. All you need is a pair of shoes. Get out there, walk your dog, take your kids, your grandchildren to the park. That's also encouraging your family to be physically active. So, in relation to this topic, Apnea Santé has joined the YMCA challenge. Uh, and so, by joining this challenge, Apnea Santé's staff has committed 30 minutes a day to be doing physical activity. And so, with this YMCA challenge, we are allowing kids to join one of the YMCA camps, especially after a whole year of being homeschooled, the lockdown, how they've stopped any sports activity or curriculum activity. So we just want to make sure that the younger generation gets involved and start a more active lifestyle. So we will be, and if you want to donate in this campaign, we will be linking the link in our description box. So once again, thank you very much, Louise. That was very interesting.
Thanks, Riz. Thank you very much. And thanks
Thank
to
you.
everybody for listening.
Yes. So wishing everybody a good day, and we'll see you again next week. Bye.
Bye.